beauty mean is about power. It's the true power. And also, I know it's one meaning or it would be power, and then two meanings, it would be more than two meanings. It's also health. And oftentimes, especially with the female, which is beauty is our identity. And there's no shame for saying that. Like I feel like I'm powerful. I'm in a beautiful mind state, beautiful, health state, beautiful outside, including. And I'm a powerful woman. And I think beauty is the most powerful thing in the world.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Enga Nelson of New Med Clinic. She's a board-certified and licensed family nurse practitioner. Her 25 years of clinical experience cover all aspects of the medical sciences, including hormone replacement therapy and peptides, psychiatric specialized care provider, and family and primary care practitioner, a unique qualification in the clinical aesthetic sector. She strives to help patients from many ethnic backgrounds by understanding their cultural, social, and language needs. So Enga, welcome and glad to have you here.
Thank you so much. And I really appreciate you invited me this podcast.
Yeah,
it's an honor to me.
Well, I'm glad to have you here. So let's start
Thank
off with
you.
this, Enga. How did you first get interested in the medical field?
I came to the United States when I was 16, and I had no idea what major I should choose. And then I was looking at my colleagues, and they're choosing the finance and accountant. And I just really, really actually, this is how I can start. I start working nursing home as a CNA. And then I just loved it to have to take care of people and have passion and how much you can give it to the community. And then I look at the nurses, what I can be. And I mean, as an international student, as an F1 visa, it's really hard to be a doctor in here. Because, you're not really qualified for a student loan. And then my route is being medical professional, as being a nurse. And then I learned being nurse practitioner, and then you can just expand your specialties. So that's how I started with being a nursing and then a nurse practitioner.
Okay. And then when did you start to make that transition over to aesthetics?
So it's interesting. It's a background. When I was 5 years old, I had an accident. I had a 3rd-degree burn in my forehead, my face, and my arm.
Wow.
So I had probably about 27 surgeries in total of my lifetime. It was all reconstruction surgery. But what I learned about skin so much, because you have a 3rd-degree burn skin, and then when you become a teenager, you become having those hormonal issues, which is acne scars, and then melasmas. So I was just doing the same procedure on my face. I went to a lot of dermatologists, and there weren't anything really fit on my skin, because I was like, very, very hard one is like my skin is the baseline is already damaged, and then have this cystic acne, and then this is my biological problem, which is hard. And then I decided to learn about in my way to be which treatment it really works, which is the oral medication and also the topical and then laser. It's all combined. This is how your skin's gonna be works better. So I start having the training with them. I don't know if he's still here or not. He was a chief dermatologist at the University of Utah. I followed him. His name is Dr. Rockwell. And I had 4 surgeries by him with the CO2 lasers and then with Accutane, all the treatments. And then that's how I deeped into the skincare. I learned from certain things you can do with the plastic surgery, certain things you have to do with the laser, certain things you have to be on medication, certain things you have to be on a topical. So I have to learn from which one is the best for the patients. That's how I started learning a lot of skincare.
Got it. And then what caused you to want to open up your own practice?
That's the inspiration. I want to help people with what's the best treatment for them. And it's, I already grew up having this skin issues, and, it's really hard. It took me about literally 20 plus years to figure out what really works the skin. And every skin is really different. So for instance, Asian Hispanic skin with melasma, laser does not work with the melasma. You
Mm,
have to be taking oral medication or a cream would work. Versus Caucasians with the lighter skin, with the blue eyes, laser works with melasma wonderfully. The age spots gone really. And that's, we learned about, like ethnicity, skin type, aging, what type of the skin. And that's why I feel like I can help them because I know what's the best for them. I know they don't have to waste the time for searching for other answers or some gimmicks. They also looked at the social media. Oh, did you see this one? This is really works. This chemical pill really works. And I always advise them the best is you probably have some percentage have the success, but the other percentages like have to take care of your skin, but other treatment will help you to achieve your goal. So it's kind of like skincare is very individual, but everybody's skin is really different.
mm,
And also I noticed there's a lot of filters. And nowadays it's like people really, really compare themselves of having a filtered look. But
mm,
I have to be honest with them, that's something it's kind of like not the real skin should be look like this. And
mm,
then achievement, and then what's the root causes it's causing it. So
mm.
that's why I want to help the people that if it's the wrinkle or if it's the melasma or if it's acne or the pore problem, so I can help them most of the people. And also the last result is I can tell, which is the water sagging skin on the eye area. Sometimes the really only answer is the surgical care.
Mm. Okay. So it's really gonna
So
be
yeah,
individualized.
it is very individualized. Yeah.
Okay. Now, you talked about skincare. I want to go into some of the other treatments. I know you offer a lot of different types of treatments. I want to dive a little bit deeper into hormone replacement therapy,
Mhm.
since that's something that it seems like it's becoming more and more of a hot topic. I don't think a lot of people really understand it. So I want to have you help people understand some of the what goes into it. What is it? So let's start off with that. Like, what is hormone replacement therapy? If we explain it to a fifth grader.
This is gives me chills because this is how passionate I'm about the hormone therapy. So we, especially the female, it's a big need. It's actually a lot of women are suffering with the hormone deficiency. So what happened is when you're born, like starting from embryo, you have only few cells of the certain amount of estrogen ovary is going to have the certain amount of cell in there. So when you're aging, after you have, usually the average is you are out of hormone, which is estrogen, is stop producing it 39. For globally, it's usually after 35, especially with kind of like a poor country, they start really early. We don't know why, but an average in globally in America, it's 39. We start having it's called perimenopausal. So perimenopausal is the most horrible time of the woman. So what happened is your hormones is decreasing. Your brain's going to have a foggy, and then you have no energy, you have no sex drive, and then your skin's going to be drying, and you're going to have a constant UTI, muscle ache. And then when you go to like a primary care, which is I mentioned to you, I did primary care, and when you go to just a regular doctor, they says, well, there's nothing wrong. We can check your thyroid, and we can check anything autoimmune, and then they check the lab. You're fine. Just take NSAIDs or take something. What are you in a depression? You got to see the counseling or psychiatrist to see your depression or being brain fog. And your moods also affect hugely. It's like it's almost like a raging angry lady. And then we call those Karen moment, right? It's usually those perimenopausal ladies or postmenopausal ladies because estrogen is getting it down that it's just you just have no tolerance with anything. So that's what we had a wrong study done in 1992 that when HRT, which is a hormone replacement treatment, and then they have the wrong data that it causes a cancer, it causes heart attack, it
Mhm.
causes all kind of problem with also urine cancer, and it's also like it's all the wrong data, and people scared to practice this hormone replacement therapy because nobody put their practitioners want to put their license in a danger that cause any issues with the patients.
Mhm.
But for those 20 years, it was only a few people get treated, and it's just horrible. What happened is when you're not getting treated when you're on perimenopausal age, which is 39 to average about 53, you're going to have a horrible osteoporosis, which is a bone loss. And then your heart's having your cholesterol, you're going to have a heart problem, which is heart attack, strokes. And then you're going to have the UTI. And then when you break your bone, you're either going to have a surgery or you're going to die. That's the high chance. And then also estrogen, progesterone, testosterone, it's all also helps to reduce cancers. Obviously, we can't tell you 100% it's going to prevent the cancers. And those hormones are really, really deficient to it. But when you menopause, it's saying that if you are out of period for more than 12 months, be diagnosed with the menopause. So after menopause, let me tell you, there's nothing good about it. It's just you getting aging harder. Your heart's not going to work really well. You're going to have a cholesterol. You're going to go to primary care. You're going to get a cholesterol medication. It's not going to do a whole lot, but it's just you are pretty much on quality old age, waiting for dying, or you're going to wait for break the bone or UTI and your heart problem. So woman's the most a killer is the heart disease and heart attack and stroke. So having hormones starting early, which is your ovaries still producing some of the hormones, when you are getting handled through it, like starting 39 for average age, you will get your heart protected because your estrogen is going to work pretty good and it's going to heart protect you. Cholesterol is going to be average really, really good. And also your bone's going to be not going to be horrible osteoporosis, bone protective. And then also, you're not going to have a UTI, which is urinary tract infection. So estrogen is the main hormone with the progesterone is balancing everything. And then also, we also need the testosterone too. FDA is still not there yet to approving the testosterone, but they did approve estrogen, progesterone for hormone replacement therapy for everybody who needs a hormone replacement therapy. So, which is good news. Yeah. So now it's the huge one. It's like I don't know how I can explain you better. You need the hormones that you're gonna run out. It doesn't matter you eat healthy. It doesn't matter you exercise. It doesn't matter you have a perfect gene. You have to have your hormones. So what you can get it is do it by bioidentical. There's a lot of ways to get it done. Your insurance will cover it. If you don't have insurance, you can go any clinics who does that, but you have to be very careful with that. The providers that is that really it's based on kind of like we call them, it's kind of black market. Is it based on it's really the patients need them? Did they draw a lab or did they know your symptoms? How much dosing they need? And if there is, and a better way to get it done is trying to get through all the hormones right now, even the pharmaceutical, it's most of them, it's a bioidentical way, which is a patch and cream. Mm-hmm. And progesterone is another hormones you have to have it is, in my experience, maybe it's a different hormone therapy, maybe I have a different opinion about it, is oral is the only one is working pretty much better. The reason is they try not to give you any oral hormone is because it's a long-term treatment and they try to be not causing any liver inflammation. That's the whole thing about getting bioidentical is you can do pellets, you can do cream, you can do gel. Progesterone is, I don't see a lot of success on creams and troche, which is on a mucosal, but a pill is right now, which is the capsule before you go to bed, and that works a little better. I'm pretty sure pharmaceutical company is going to make a better version of the progesterone pretty soon. Mm-hmm. So you have to have a hormone. So that's I'm telling you, if you are suffering, you don't know what to do, it's probably you need a hormones.
Okay. And you mentioned that earlier on, hormones stop. Do they stop at around age 39 or they just start to slow down at 39?
It starts really slowing down 39. That's why you start having symptoms. So most women, they're coming into the hot flashes, the sweating and not sleeping, low sex drive, no energy, and being forgetful. It's at the point is like you go crazy and you don't know what to do. Mm-hmm. And then it also causes work productivity. So usually most women, when they're 39 and after 40s, they raise their kids, they're in the like in the level of the good career that they said you can do it, right? Because you can focus on the work, you can just more productive feel. But your mind is pretty good. It's like you can do it. You finished your school, you raised your kids, but your body is like, I can't do it. I really cannot do it physically. The only thing is taking our work done is your mind, and your body is just like, I'm done. It's like you are driving with a car without fuel or without oil. And
Mhm.
that's how your body feels. And then all the symptoms is gonna go when you're on the hormone therapy. But it's very interesting that younger people need more hormones than older people. It's
Hmm.
very interesting
Yeah.
because you think it's about like, oh, the older people need some more hormones. No, it's actually the younger people need some more hormones. So
Mhm.
it's a very smart to start 39. That's the average age. I'm not saying it's the perfect age, but there is a couple exceptions. When somebody on surgery, which is hysterectomy with ovary removal, that puts them menopause automatically. That means ovaries out and you have no hormones to produce. So you really have to be on hormone therapy. A lot of us, which is third world countries, they don't know how to do the hormone therapy. It's really sad
Mhm.
when a woman's on an early age, even the 20s and 30s, they had a surgeries. They just don't know how to do it. And I'm originally from Mongolia, and it's one of the very huge needs and a very struggle with the hormone replacement therapy. And this is the one thing is my another project is I'm working on helping the other providers in Mongolia have to do it in the correct way, which mean is the bioidentical way, is the key answer to be on hormones.
Okay.
And you're never going to be overdosed. And also, it's the best way to get it. It's like your body, you're getting the hormones exactly what the body makes them.
Mhm.
And that's the key.
Mhm. Okay. Now you talked about women quite a bit. What about on the men's side? Do the men kind of follow the same as far as age, where testosterone starts to drop? I guess what are the biggest differences when it comes to men?
Yes, it's the same age, about 35, but it averages, I'm not a urologist. I'm not like a sex therapist or whatever it is, but what I've seen in men's is in the most is it's a big issue with a lot of men's they desperately need them, but then they do it in a secret way. Like
Mhm.
there's a lot of places like men's health and stuff. There's usually testosterone replacement therapy,
Mhm.
but I just want them to be careful about it because I have quite a few male patients are they need a testosterone, but there's a lot of ways to. You don't just need to get an injection or pellets done, but also there needs some medication to help you to produce your own testosterone.
Mhm.
So I wish other clinics they start with the medication. They start with which is the one of the hormone is HCG, which is makes the testosterone, kind of amplified. Your body just whatever is lacking because sometimes your brain is not sending a signal for your um, testicles to not making enough hormones, but it's that connection between your brain and your testes. So I mean, I cannot tell you like very precisely, but we just need to get a really good labs and what causes them, and then we can do the testosterone. The one of the bad thing is not everybody needs a testosterone. They sometimes just the medication to makes it more amplify your making your own testosterone. But after 35, usually it's very declining with your testosterone production. And then I would just do usually most clinics do the injection. But I think that one of the perfect answer is do cream and patch first and see how you feel.
Mhm.
And one of the biggest thing is people don't want to wait. They just feel like, oh, it's not working. But it takes about 3 to 6 months you get the level. And it's not working. Absorption level, whatever it is, it's not working. And then testosterone injection is good. But once you are on hormones with the testosterone, you really have to be careful. You really can't quit. It's like a kind of prescription drug that, like kind of opiates that it's in a way when you use them wrong, it's very addictive a medication. Yeah.
Okay.
But I think everybody benefits to it. There's the
Mhm.
benefits of wonderful, but I feel like a lot of providers really, really passionate about your patients. What
Mhm.
if that's your son or your husband? Would you just not gonna inject something? It's like just feeling good, or just gonna have a better muscle mass, and you just need to get this labs done and get it in the right way. Well, when you do it in the right start, in the long run, it benefits the patients so wonderfully. I have a lot of patients who transferring from the men's clinic to me. First of all, my pricing is better. Second of all, is I more give them a transparent answers that some of them we can just try to get it covered by insurance. Some of them we can just get a compounding pharmacy. Compounding pharmacy also does a wonderful job for customized medication too.
Okay. Now, with this treatment, I'm sure that there's a lot of misconceptions or myths around it. One, you mentioned there was that study that was done that made people think hormones cause cancer, but it was really poorly done. But
Mhm.
outside of that, what are some of the common misconceptions or myths that you hear from your clients and your patients about this treatment?
They think it's just the misconception is they can just use them 3 months and then they're done with it. And
Mm.
that was the huge, which is my clients is like, oh, I'm not looking forward to use them. But the one of the thing is, especially the female, if they're trying to have a kid or if they're going to get pregnant, that's not the treatment for them. They have a misconceptions about being hormone therapy, like they can have a being pregnant. That's absolutely contraindicated. So my first thing is if anybody wants to have a hormone therapy, male is a little different. So they can be on medication to be still having a kid if they're not done with the kid. Female with the hormone replacement therapy, they're absolutely done with the having a kid, and also they need to have a contraceptions or any forms. So they cannot be getting pregnant with while they're on this medication.
Mm.
Um, Cancer is there is very, very a weak correlation with between this hormone therapy. Even though people who had, which is the relationship here, usually the most cancer with the females is the breast cancer,
Mhm.
or it's another is cervical cancer. Um, Breast cancer is more than 70% is not related to genetic.
Mm.
We still don't know why is causing it,
Mhm.
but there is a that's what we cannot pinpoint is that really causing it. But if is estrogen dominant cancer, which is they're more worried about it, is I would be gladly work with who's oncologist or primary care, what we can prevent with it. But usually those kind of treatment is we just still have to be screened very careful with it with estrogen dominant cancer, which is it can be hormone therapy or it can be, but we don't want to have a chance to having more cancer issue.
Mm.
And now what I take the patients is usually we draw labs and we go a little background. But if they did have a history of the cancer, of that breast cancer or any female type of the cancer, I would always refer to the OBGYN. Make sure everything is clean, make sure everything is there's genetic test done also.
Okay. Now, Enga, for people looking for this type of treatment, if they're looking for a provider who can help them, guide them, really make sure that they're taken care of, what piece of advice would you give to that person as when they're doing the search for that right provider?
Mhm. Don't wait. And if you start having symptoms or just looking at your age, and I would just go to, at the first care is that I would go to OBGYN, which is your, you know, the the woman doctor, we call them it, OBGYN. If they have a less options, I would just shop around, see who's going to help you with. A lot of OBGYNs not trained with the hormone replacement therapy.
Mm.
But what they can do is they can start you pretty good. At least they draw your blood and you have the baseline. And then they'll tell you there's a risk and there is something they can help with it. If your OB/GYN cannot help, then you can look into hormone replacement therapy specialist, which is like it could be a medical doctor or it could be a nurse practitioner. And that's why you can see it. But I just don't want you to be like excited about it because most people have a misunderstanding that when you're on hormones, it's like a meth effect. They feel like, oh, I'm going to feel better tomorrow.
Mm.
It won't happen tomorrow. It might even take years to get the level out. So it's a very slow process to get feel better. But once we get the level down in correctly way, you're on these hormones. Like there's no expiration date. You can be on 70 and 80s. Who knows? It's going to be a long time. And then that way you preserve your bone, you preserve your heart, you preserve your skin, you preserve your, I mean, the vaginal care, everything. So that's just the one thing is the first year is the most hardest year for a woman because they want to feel better right away, like an antibiotic, like 3 days, I need the result. It won't happen that way. When you get the right level, which is that's why we're doing a bioidentical way, is it's a slow, but that's the only right way to start with the hormones that you most likely not going to have a less side effects. And also the long run, it wins.
Mm.
It really wins.
Yeah. Okay. Now, when it comes to throughout your experience, I'm sure, Enga, you've seen some challenging cases or just memorable cases that come to mind. Is there maybe one story that comes to mind that you're able to share of a tough case, challenging case, memorable case, and how you were able to get them a great outcome in the end?
The mice, there's a lot of cases. The one of the things I can remember is I have a patient. She was obese, and then also she had a irregular period, and also when it comes to her period, it goes really, really heavy. It gets the point is like she become a very deficient with iron deficiency. And we're trying to figure out so many things. When we start hormones, and then she's having a lot more bleeding action. That's what usually happens when you have this uterine cyst. And then we at the point is like we have those trials that we start a medication, which is we're going to up the progesterone and see how the bleeding is going to stop. And she didn't respond it. And then we start with the ibuprofen, which is it's the Motrin. It's a high dose, and it didn't stop. And then we have to put her in either it's going to be IOD or we're going to do oral birth control. And the oral birth control, she did respond. Then unfortunately, she didn't want to continue with this hormone therapy because that's what people are afraid. Once you see that one of the side effects happening, everybody's different, they stop them. But there's a lot of ways we can do it. We can send them to this specialist. We can, send them maybe even like the cauterizing surgical procedure. We send them to the clinic? But most people, they just not really committed, but they just see the side effect, they quit them. Obviously, we train for this. We, prepared for the worst. If something happens, and 80%, usually more than 80% people, they responded really good. Very slight side effects, which is have a little acne, or which we call is a little bit breast tenderness. That's really normal. Those side effects are really minor one. People usually, or for females, sometimes when the level's a little bit off, they lose their hairs, and that's why they're scared of it. So if you get by, that's why we check them labs every 3 to 4 months, and then we just go on. There's a lot of things we can help with. The first year, if you are kind of like consistent with it, and then it will be great. But I think some of the people just they don't want to feel that side effect. Some people are oily based skin and finally dried out, and then have a little acne comes on, they freak out. They do. It's like, hormones is kind of teenager. You become a teenager, like everything oily, everything is moist, everything more energy. You have good things, but a little acne will just stop you. My advice is do not stop them. Just those little minor effects. We can treat them. We can treat acne. There's a different way we can get it done.
Okay. Good advice. Good advice.
Yes.
Now, Enga, where do you think the future of wellness is going? Since this is kind of more under the wellness arena than aesthetics, but where do you think the future of wellness is going?
So it's longevity is the best medicine, and also the preventive care is the best medicine. And a lot of people are traditional medicine, which is we go to get the doctor, get a prescription. If something happens, we just more like a treatment wise, a masking treatment, which is you get this one, and then you'll get a side effect anyway. But right now is how we're going to prevent this problem. One of them is the hormone therapy. It's
Hmm.
definitely preventing aging,
Hmm.
definitely preventing a lot of health problems. Another thing is the amazing things, the peptides. You
Hmm.
probably heard about GLP-1.
Hmm.
It's just the Ozempic and Manjura. That's the one as a GLP-1. It's the one of the peptides. And it is how amazing is the weight loss is losing 10 pounds and 20 pounds. It gives you how much health benefit, how much preventive care you can get it. And a lot of people are very different opinion about it, but it's mostly benefit. And I love peptides and I love GLP, but if you go by prescription grade, and which is the doctor's advice and being this like under the care, those are the great treatments for longevity and also preventive care. I think the medicines go towards to more towards to the preventive care, which
Hmm.
is definitely peptides and hormone therapy is you know of them. And it's excited now. It's AI is getting crazy.
Hmm.
There's getting a lot of crazy formulas out there. And just FYI, I use them all. I use a GLP-1 and I lost 70 pounds.
Wow.
It's almost like a magical treatment that
Mhm.
puts the cravings to in your brain to sleep. Is It's like effortless. I mean, I don't know how I can. I struggle my weight ever since I was 12, and I know how it is. And there's a diet, there's a things I didn't try. I tried everything, but with the peptide is a magical. It's a next to the magical thing. And the hormones, same thing. I'm a 43-year-old. I have two kids. I'm done with having a kid. Um, my husband's almost can tell me my period comes in or something going on. My mood swings like crazy. And then when usually the sensitive time, I couldn't even get out the bed. But I wouldn't tell my coworkers. I wouldn't tell my colleagues because I'm the provider. I should
Hmm.
be better, right? I should be a good example. I shouldn't be saying I'm depressed. I'm just my body is not functioning. I just didn't want to get out. We shameful. Like we don't say to other people like, "Oh, I'm good," But inside I was suffering. But once I start this treatment, Daniel, it was the most amazing thing I tried, and if I have to try it with my kids and my husbands and my sisters, my mom and dads, this is a treatment, and it's also preventive care, and it's amazing how
Wow.
much it does to you. It
Yeah.
really does.
Wow. It sounds like it's a bright future ahead then.
It is. It is. It's getting more better formula. It's amazing. And there's you can don't have to be just struggle with it if insurance doesn't cover. There's another way to you can get a prescription grade, USB grade to get it done by different ways to different providers. Now it's like a medical service, it's like a buffet. You try, and if it doesn't work, you can try different things. And patients have more like a power than a provider. They actually now in the age that you can choose what medicine you want to go through it. With
Hmm.
the cancer treatment too. The traditional one is the platinum care is you got those horrible chemo will kill. I mean, kill your cell, good and bad, and they'll go through it. But guess what? Insurance will cover it, but you'll die. But it's your quantity of life is going to be a little longer, but quality is going to be not good. But insurance will cover it. We'll get it. Or you can go to holistic treatment, or you can go any private practice with cancer care. You can get ivermectin with the oral medication. You can get treated that cancer,
Hmm.
but you can get a good pricing. You don't have to go pay thousands of dollars. It's like one pill. It's like cost you $2. You can do that. There's a lot of ways to do it. So I just want you to know when everybody knows they have so many options, they can do it. There's so many options they can do it, and don't give up and just try what works for you, and then just go for it.
Great
And
advice.
there's so many good studies there, and everybody has have access to have this. literature, study, and science behind it, you can read about it. Not just go by TikTok or social media or trying to be sell something.
Okay, well, that's good to know. I mean, it sounds like it's a
Yes,
great future ahead.
it is.
So, Inga, I have one last question for you, but before I ask it,
Mhm.
I do want to point people to your website at newmedclinic.net. Now,
Yes.
last question for you, Inga. What does
Mhm.
beauty mean to you?
Beauty mean is about power. It's the true power, and also I know it's a one meaning, or it would be power, and then two meanings, it would be more than two meanings. It's also health. And oftentimes, especially with the female, which is beauty is our identity. And there's no shame for saying that. Like I feel like I'm powerful. I'm in a beautiful mind state, beautiful, health state, beautiful outside, including. And I'm a powerful woman. And I think beauty is the most powerful thing in the world.
Awesome. Well, there you have it. Inga sharing your expertise. So, Inga, where can people contact you in your practice?
They can actually go through my website. They can, just write about, there's a submission you can do, contact us, click on it, and they can just send it, like you can just click on that submission aside. You can just say what service you want and we'll contact with you. Like it's the only thing is we are a little behind is I have so many patients that we go by the urgencies. If it's a hormone therapy, I usually go trying to be urgent as possible, go first. But if it's like, a little bit of beauty treatment with the filler and Botox, it's kind of my second priority. My priority is the hormones, and I know how they're feeling. They're suffering. They shouldn't wait. I try to take their priority of my patient.
Okay. Well, Inga, thank you for coming on. Thank you for sharing your message. This is great.
Thank you, Danielle.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.